Hello, everyone, and welcome to this audio podcast. This audio podcast as part of this series or edition, the cortical capacitor. This audio podcast is part of MaxxaR Pathology, and this audio podcast as part of a Storm Robotics production. In this audio podcast, a little bit around works, sort of peer-reviewed and published works from 2014 where this audio podcast is part of the series will look at electronic patient records, EPR, library services, a multidisciplinary team sort of meetings, and where the published works from 2014 ask the question: is it not time to integrate primary care for the better? This collaborative, this works was the original works, published works, was collaborative between colleagues in the United Kingdom and the United States, and this and in this audio podcast, in this particular audio podcast, there are specific examples in around works in around works and in around the works and sort of the basis of the of the in around the sort of objectives in meeting the sort of objectives of this works. So a bit of an intro. So looking at sort of practices in around sort of primary care, or sort of where primary care in linking with sort of secondary care. So living with a long-term condition can be viewed as a sort of major stressful event, and characterized by a number of recurrent stressful situations that pose serious challenges to adaptation. Patients have to sort of cope with challenging situations, and depending on the results of sort of in around coping, in around aspects around coping, they may be able to sort of maintain adequate levels of sort of functioning in around and across various spheres. Inspired by sort of the stress coping the sort of stress and coping works of Lazarus. Research has explored, or research works has delved into sort of the sort of in around patients and illness, in looking at sort of illness in varying varying health conditions, and sort of in around sort of linking sort of long-standing conditions, disabilities, and in around sort of terminal illnesses as well. So although research has provided sort of valuable insights into the ways patients use healthcare services, it is difficult to determine sort of the precise understanding of such information across different illnesses. It is important to gain better insight into the type of stresses experienced by patients suffering with different diseases, as information on the nature of disease-related stresses may contribute to the better understanding of patients and the general public. By implementing sort of tighter integrated services in around primary care, and improving healthcare experiences, this can improve well-being and progress general healthcare, or generally in around healthcare healthcare aspects sort of generally. So understanding how patients and the public access information is thus important, considering many may feel less positive about sort of competencies with some who may feel inadequately prepared about healthcare, and this places them at higher risk of poor healthcare when compared to peers. and there needs to be sort of a broader access to knowledge and understanding, such as directories with information, leaflets, for example, documents, books around books around illnesses, various sort of illnesses and conditions, and helpful contacts, sort of sources and sort of sources to information that can support patients and the general public on the most important elements around health. This cannot be achieved through just patients accessing, for example, their medical records and general practice in and general practice or general practice sort of alone. The issue with current practices, or sort of one of the sort of issues that this works sort of delves into, is that there has been a lack of integration, not only between healthcare sectors, but also between sectors, between healthcare sectors and community. That draws this audio podcast to a close. This audio podcast as part of a Cortical Capacitor. This audio podcast as part of MaxxaR Pathology, and this audio podcast as part of a Storm Robotics production.